Hi, my name is David Emerson. I'm a long-term myeloma survivor, myeloma coach, and director of People Beating Cancer. Welcome to the vlog post about post-thrombotic syndrome, PTS for short. It's much easier to say. PTS is just like it sounds. Post-thrombosis, a deep vein thrombosis, is a blood clot. A common symptom and a common side effect for myeloma patients is a blood clot, is a deep vein thrombosis. Happened to me twice. First during induction therapy, second time shortly after my autologous stem cell transplant. The bottom line is, frankly, I don't know how common it is, but it is a documented side effect of a side effect. So, in my case, not only was it important to identify it, so here's basically what happened in this may be happening to you. So I have one blood clot, go to the hospital, I resolve it, have a second blood clot a couple years later, pretty much resolve it. And I know that because ultrasounds can take a picture of the veins and they can see what's clogged and what's not. Post-thrombotic syndrome, my PTS, was difficult to figure out because there's no blood clot, yet my calf, in this case my right calf, swells if I've been standing for some period of time. Perhaps at the end of the day, perhaps I've been walking around. So what's going on there? No pain, it's just fatter, like it used to be when there was a clot, but it's not really that fat. And I can make it go away after a good night's sleep. There's no more swelling. Bottom line, post-thrombotic syndrome. So what do we do? What's the therapy? I can't prescribe therapy because I'm not a doctor, but I can tell you what I do. I take those supplements that actually are important for keeping me in complete remission: curcumin, omega-3 fatty acids, wobenzyme, a combination of proteolytic enzymes that research shows thins my blood. I don't recommend taking that with a blood thinner, but talk to your doctor about that prospect. So, thins my blood. Research says that wobenzyme N actually eats, helps to keep the clot either negligible or makes it go away. For me, it's been about 15, 20 years now since I've had post-thrombotic syndrome. It doesn't really impact my day. It's just something like every other side effect I've got to be aware of. I want to make sure it doesn't get worse. I would love it if it went away completely, but I'm kind of managing it like many of my short, long-term, and late-stage side effects. So, post-thrombotic syndrome, it's an after effect. Picture a little bit of sludge in that vein. There used to be a lot of sludge in there when it was a full blood clot. Now there's just a little bit there. The blood slows, I think, the circulation, so it swells a bit after standing too long. I take supplements to thin my blood and to manage my post-thrombotic syndrome. If you have any questions, comments, scroll down the page, write me a question, I'll answer you ASAP. In the meantime, hang in there. Thanks for your time, and I'll talk to you soon. Thanks, bye.